Hello students. In today's lecture, I will tell you about the section of medulla oblongata at the level of olive. Now you know that the sections of medulla oblongata divided into the three parts. You have the lowermost section, that is the pyramidal decussation, middle section at the level of sensory decussation, and the upper level of the medulla, that is the section at the level of olives. So today we'll discuss this uppermost section, that is the section at the level of olive. So transverse section, when you will do the sectioning of the medulla, you have to keep this thing in mind that this section passes across the floor of fourth ventricle dorsally. Now this is the most characteristic feature of this section. So there are two most important features of this section. First one is that you are going to see the floor of fourth ventricle, which is absent in the remaining two sections of the medulla. You will find the central canals present in the sections of your pyramidal and sensory decussation, where you don't have the central canal. Rather, here you will find the floor of your fourth ventricle. And second thing is then when you will see the ventrally, you will find the olive. So the olive is a very prominent and pronounced feature of this section. So here in this image, you can see that in the center, you will not find any circular canal. On the posterior side, rather you will find this open area, and this open area is the floor of fourth ventricle. So in this section, the most striking feature is the presence of the floor of the fourth ventricle instead of the central canal. The central gray matter also is spread over the floor of fourth ventricle. What is happening? That your central gray matter mass. Now here you can see that all the nuclei now comes along the floor. In the section of your sensory decussation, you have drawn all these nuclei around the central gray matter. So there you will have the central gray matter, which is having the central canal, and all these nuclei are present in the central gray matter here. But here what is happening, that this canal is not present. Rather than the canal, it is opening from both the side, and because of the opening, what is happening, that these neurons or the collection of the neurons or the nuclei now spread along the floor of your fourth ventricle. So this is the most important concept to understand. So here on both the side, if you will see, when I am drawing the section at the upper part of medulla, anteriorly it is passing through the olive, but posteriorly it is passing here through the floor of fourth ventricle. But when you are taking the section at the middle and the lower portion, you will find the canal is present here. But as soon as you will reach in the upper part, the canal is disappear, and you will have a very big area in the posterior side is the floor of fourth ventricle. So presence of the floor is a characteristic feature of this section, that is the section at the level of olive. So the total amount of the gray matter has increased in this level. Now at this level, the gray matter is maximum as compared to the remaining two sections. Now why? Because there is a presence of more nuclei other than your hypoglossal, other than nucleus tractus, other than your dorsal nucleus of vagus, which are the common nuclei in the middle and the upper section. But in upper section, other than that, you will have a very prominent feature of the presence of olivary nuclear complex. You will have the nuclei of the vestibulocochlear nerve. You will have the nucleus ambiguous along with these remaining nuclei. So because of the increasing in the number of the nuclei, the gray matter mass increased in this level. So if somebody will ask you that there are three levels of the medulla, upper, middle and lower, which part of the medulla is having maximum number of the gray matter? Answer is at the level of olive or upper part of medulla. So what do you mean by the olivary nuclear complex? At this section, this olivary nuclear complex is a most pronounced feature, and the largest nucleus of this complex is the inferior olivary nucleus. Now because it is a complex, that means it is a combination of three nuclei. Now out of these three, the inferior nucleus is the most prominent feature. The gray matter is this inferior nucleus or the inferior olivary nucleus is a crumpled bag-like appearance. Now this is a question for your exam, that what is the shape of the inferior olivary nucleus? Answer is crumpled bag-like appearance. And its mouth is directed medially. So this is the medial side where you will have the opening of this nuclei. Clear? Apart from that, this inferior olivary nucleus is so large that it is able to produce the surface elevation which is known as olive. So when you are drawing this section, you always draw this pronounced elevation just next to the pyramid, and these elevations are known as olive. And this is a very commonly asked question, that why this prominence is present on the medulla or the olive is present. Answer is because of underlying inferior olivary nucleus. Clear? There are two more nuclei you will find. This is the medial nucleus and this is the dorsal nucleus. So there are three olivary nucleus: medial, dorsal and inferior olivary nucleus. Out of these, the inferior olivary nucleus is the largest in size, and this is a crumpled bag appearance, and this nuclei is responsible to produce this prominence which is known as olive. Clear? Now, when you will see the central grey matter, now this is the important concept to understand, that central grey matter, when you are drawing the section at the level of sensory decussation, you draw a closed central grey matter. And in that closed central grey matter, centrally you will have a central canal, and you are drawing the nucleus on both the side of this midline: hypoglossal nucleus, dorsal nucleus of vagus and tractus solitarius. But now what is happening here, that this part is open up. And once this part is open up, what is happening, that these nuclei now comes under the floor of your fourth ventricle. So now this area has been opened up, and because of the opening as a floor of fourth ventricle, these centrally placed nuclei now comes here. So you will find the presence of these four important nuclei in the floor of your fourth ventricle. What are these nuclei? Hypoglossal nucleus, then the dorsal nucleus of vagus, then you will have the nucleus tractus solitarius, and there is a one more add-on nuclei, that is vestibular nuclei. Clear? So this is the important thing to understand, that whenever you are drawing the floor of the fourth ventricle, you are having these different areas also, which you can appreciate here. Now this is the area of your up here, which is forming the lower part of your this floor of the fourth ventricle. Here you can draw these nuclei also. Now this is your midline, and next to the midline, when you are having this part, now this part is known as hypoglossal triangle. This is hypoglossal triangle. Next to that, you draw the vestibular area, and below here you will draw the vagal triangle. So in these areas, you will have the respective nuclei. So in this section, we are drawing the respective nuclei. This is your hypoglossal nucleus. Then this is your dorsal nucleus of vagus. Then this is nucleus tractus solitarius, and laterally you are drawing this vestibular nuclei. Clear? So my dear students, what is the difference between the section at the middle portion and upper portion of medulla? That in middle portion you will have the closed grey matter, but in this section the grey matter is not closed. You will have the floor of fourth ventricle, and deep to this floor of fourth ventricle, the grey matter is arranged here. Clear? So nuclei are now arranged here along with the floor of fourth ventricle. So this is the one thing. Now the second thing is, when you are having the vestibular nuclei are again four in number: medial, inferior, lateral and superior. But my dear students, all the four nuclei are not visible in the section because they lies very deep in the medulla, but one or two nuclei are visible. Now this is the vestibular nucleus, which is visible on most lateral part of this floor of fourth ventricle. Clear? Then you will have cochlear nuclei. Now there are again the two cochlear nuclei. Now the cochlear nuclei are ventral and dorsal cochlear nuclei, and these cochlear nuclei are lies in relation with the inferior cerebellar peduncle. So these are the cerebellar peduncle. Clear? So what you are drawing here on the lateral side, this is your cerebellar peduncle, and one nuclei lies on the upper part of the peduncle, and one nuclei lies in the lower part of the inferior cerebellar peduncle. So here you can see that this is the one blue dot, this is the superior nuclei of the cochlea, and this is one more blue dot which appear here is the anterior or ventral cochlear nuclei. So these are the two nuclei which are present in relation with the inferior cerebellar peduncle. Then you have the nucleus ambiguous. Now nucleus ambiguous is a motor nuclei, and it supply the voluntary skeletal muscle, and this nuclei is again contribution of the three nerves. What are the three nerves? Glossopharyngeal, vagus and cranial part of the accessory nerve. And this nucleus ambiguous is again a very important feature of this section, and you have to draw the nucleus ambiguous here. And this nucleus ambiguous, because we are dealing with the lower 4 cranial nerve, that means 9, 10, 11 and 12, which are present or exit from the medulla. And here also you will have this glossopharyngeal, vagus and cranial part of the accessory. So this will come under this area. So that's why you have to draw the nucleus ambiguous also, because the nucleus ambiguous is a nuclei of glossopharyngeal, vagus and cranial part of accessory nerve. Now arcuate nuclei. Now in my class of the section at the level of sensory decussation, I told you that there are 3 sets of the arcuate fiber: internal arcuate fiber and external arcuate fibers, which are of 2 varieties: anterior external arcuate and posterior external arcuate. Now this internal arcuate fibers are the fibers which arises from nucleus gracilis and cuneatus, and external posterior arcuate fibers arises from the accessory cuneate nucleus. Now today we are talking about anterior external arcuate fiber, and these anterior external arcuate fiber arises from these arcuate nuclei. And arcuate nuclei are the nuclei which are present on the anterior aspect of the pyramid, and the fibers which will arise come out to the opposite side on the ventral surface of your pyramid. So arcuate nuclei are, what is arcuate nuclei? So they are the displaced part of the pontine nuclei, and they receive the nerve fibers from the cerebral cortex, and they will give rise to the anterior external arcuate fiber. So these neurons are receiving the sense from the cerebral cortex, and their output is known as anterior external arcuate fiber, and these arcuate nuclei are nothing but these are the some detached part of pontine nuclei. Now what you have to draw in the white matter? In white matter, this is something is very important which you have to draw in this section. Now here in this part, you have to draw from posterior to anterior side. This is the medial longitudinal fasciculus. Then you have to draw the tactospinal tract. Then you will have the medial lemniscus, and anterior to the medial lemniscus, you have to draw the pyramid. Clear? So these are the most important white matter areas which you have to keep in mind in this section of your medulla oblongata. Apart from that, on the lateral side, I told you, you have to draw the inferior cerebellar peduncle, which is again a pronounced feature of this section. Clear? So at the end, you have to understand that whenever you are drawing this section, you keep this thing in mind that when you are talking about the exit of the cranial nerve from the anterior surface, you know that this is the pyramid, next to the pyramid this is the olive, and between the pyramid and olive you can see the exit of these nerve root, and these nerve roots are the hypoglossal nerve. So this is your olive, this is your pyramid, and you are drawing the exit of this red color line, and this is the hypoglossal nerve. Behind the olive, you are having the exit of your remaining 3 cranial nerve. So here you are drawing the exit of vagus nerve. So here you can see from above downward your 3 cranial nerve, glossopharyngeal, vagus and the part of the accessory nerve. So we are drawing the vagus behind the olive, and we are drawing the hypoglossal in front of the olive. So my dear students, now this is our final output. Now in this, what you have to keep in mind? You have to draw the floor of 4th ventricle. There is no central canal. You have to draw the inferior cerebellar peduncle. You have to draw the nuclei in the floor, and you have to draw these important white matter line into the center and the inferior olivary nuclear complex just adjacent to the pyramid. Clear? So now you can compare all these 3 sections of medulla. This is the pyramidal decussation, sensory decussation, and at the level of olive. Now what is the first difference? The first difference is that in these sections you are having the presence of central canal, which is not in this section. Here you will have the floor of the 4th ventricle. The second thing is that in this section you will find that the gray matter is a single piece. There is no different nuclei, but as you are going from here to here, the number of nuclei are increasing, and in the middle portion the gray matter start to broken up into the different groups of the nuclei. And the maximum number of the nuclei are present in this section, which is the upper part of the medulla. And in this section, you will find there is a presence of inferior cerebellar peduncle, which is not present in both these sections. And in this upper part of medulla, you will have the presence of very prominent feature on, and this is producing a external elevation, which is known as olive. So olive is not present in this as well as in this. Olive is always a feature of the upper part of medulla. And in this section, you are not having any midline crossing. Midline crossings are present in these two sections. Now this section is showing the sensory decussation. This section is showing the pyramidal decussation. Apart from that, in this section, you don't have any cranial nerve nuclei. The cranial nerve nuclei start to appear in the middle part and in the upper part. The another important thing is that when you are drawing these three sections, the outline is more important. And here you can see that these two sections are almost closed from all around. Here it is not closed, it is open from the posterior side to show the floor. Clear? So now, my dear students, at the end of this session, we have finished all the three sections of the medulla at different level, and now you should have the clear-cut idea how to draw these sections and what are the important differences in these three different sections of medulla oblongata. So this is all for the session. Thank you.